Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for staying with us here on Horizon TV. This is Stay Healthy, brought to you by Nairobi Neurocare. And today's topic of discussion is all about spinal cord tumors. And joining me in studio to talk about it is none other than Dr. Mahendra S. Chouhan. How are you? Good morning.
I'm good. Good morning.
How are you?
I'm good. How are you?
I'm great. So today's topic of discussion is all about spinal cord tumors. And just for anyone who's listening, trying to understand, what exactly is a spinal cord tumor?
Well, first of all, I would like to differentiate whether what is spine, what is spinal cord.
Yes.
So again, we'll go to the split view where we can see the presentation and us as well. I request the production team. Yes. So if you see here that there is a brain, and then there is a tail of the brain which goes inside the spine, which is called as a spinal cord. But spinal cord ends at some place, which is we call as L1 or L2, at the junction of it, and then at each place there are 32 vertebrae that we have in our spine. So spine basically is akin to skull, because skull houses the brain inside, and spine houses the spinal cord inside. Spinal cord is the one which is emanating the nerves on each side at 32 levels. So there are 64 pair of nerves which control the body. So brain controls and receives information through the spinal cord. So basically spinal cord is a neural highway which connects the body to the brain. So all the sensory nerves are going back with the information, and the motor nerves which are coming out, which are creating some effects, the movements of the body, movements of the muscle. So all of it happens through the spinal cord. So when you say the tumors are there, they can come from the bone or the spine, and they can come from the spinal cord, or they can come from the nerve, okay, or from the membrane which covers the neural tissue. So based on that, we will have either tumors which are coming from inside the spinal cord. We call them as intramedullary tumors. There's no need to remember, I'm just telling. Something that comes out of this, maybe from the membrane or from the nerve, which compresses the spinal cord, are extramedullary tumors. And then there are tumors which will come from the skeletal region. So they are intramedullary, extramedullary, and then the spinal tumors. So like these are the spinal tumors which will come from the spine. They may be because of someone has a cancer which is spread into the spine from outside. So these are called metastatic tumors. So this is how the tumors are classified. Yeah.
And how common are these tumors?
Fortunately, they are very rare. Okay, if we talk of the spinal cord tumors, there would be about 7 tumors every million every year. Okay, and much less common in children. And as the age passes by 65, 70, the incidence increases. So about 75% of these tumors are going to be in old age people. Yeah, and even then, mostly they are metastasized, means they have come from another tumor into the spine. Like for females, if there was a uterine malignancy, cervical malignancy, and that actually got spread to spine. In males, it can be prostatic cancer which spread into the spine. So fortunately, they are rare.
Very, very good. And Dr. How do they come about? How do they happen? How do the spinal cord tumors
there is
happen?
no, as I said, for metastasis, we know that if there is a tumor at one part, then actually will get through the bloodstream, it can go there, or there can be direct spread. But for other tumors, there can be genetic influences, there can be environmental, but in cancers, we still don't know exactly why do they happen.
Dr. what are some of the common symptoms for anyone to look out when it comes to spinal cord tumors?
Yes, mostly it's mathematical. As I said, there are 32 pair of nerves, and then the spine. So there is a neck region which is getting connected. Okay, so the tumor will expand, and when it expands, it will compress the neural tissue. So it will depend upon the location of the tumor for the symptoms. Many times when it is coming from inside the spinal cord, then the symptoms are usually vague, but patient have felt very strange cold or hot sensation going from all the way from neck to whole of the body. Is one of the few symptoms, but it can be misleading. Then if there is a tumor, say, it all depends upon which nerve is being compressed. As if you can see here, that this is spinal cord in between, and then there are nerves which are erupting from here. So any nerve which is being compressed will create symptoms. So if it is from outside the spinal cord, it will cause compression of the root, as we call it. This is the root, and then this root is going to get compressed and give symptoms of either weakness or pain. So any patient who is coming to us with pain going from one part of the spine, or maybe the spine is basically the midline or the back, and then it radiates from one place to another. So maybe in the upper limb or in the thorax or in the lower limb, it's going from the center of the spine or from the center of your back, and then it's traveling from one point to another. It can be a symptom of nerve, although it can also be a symptom of a disc. So we don't know, but we have to do the MRI if the patient comes like this.
Doctor, how are they diagnosed? How are spinal cord tumors diagnosed?
A very simple diagnosis is the gold standard for any spinal condition is usually MRI. So when MRI can show us the bone, it can show us the soft tissue, it can show us the water around it. So MRI is the best diagnosis, very simple, handy, and now there are so many MRI centers we have, fortunately. So we are able to diagnose them very quickly.
Doctor, you've taken us through the different types of spinal cord tumors and obviously their locations. Let's talk about their treatments, especially we've talked about their diagnosis.
Yeah. Again, if we can see the presentation.
Yes.
In a split view, so if you can see, this is in general so many modalities which cover them. So it can be, it depends upon the tumor and the nature of the tumor, whether it is benign or, as we always there is, the tumor can be benign or it can be malignant. So means cancerous or non-cancerous tumors. Okay. So there can be open surgery, there can be minimally invasive surgery where we expertise, as Nairobi Neurocare expertises, and we do even the cancer surgeries only with endoscopes, which significantly reduces the hospital stay, the patient's tissue dissection. So we can discharge the patient same day or the next day. So open surgeries, then minimal access surgeries, then it can be radiation therapy or a combination of both, and we may also need to add up the chemotherapy. So these are the four things or the four pillars of managing a spinal cord tumor. If the tumor is very, very big, then minimal access surgery doesn't work. Then we have to go for a large surgery. If we go for a bigger surgery, then also we need to do fixation of the tumor, so fixation of the spine, because you are removing so many stabilizing structures of the spine, because spine is a vertical structure. So I am sitting, I am still using my spine. If I am standing, I am using spine. So, and it is a pressure bearing. So we have to fix that with screws and rods. So it's very complex planning sometimes. The tumor is too complex. Yeah.
Doctor, when you're mentioning the importance of the spine, you've talked about when you're sitting, you're using your spine. When you're standing, you're also using your spine. How dangerous is it for people who are probably going through some of the symptoms and have not yet sought medical assistance?
In cases of tumors, it's very, very important to take a timely opinion, and whatever opinion is given, first of all, if it's a tumor, always go to a surgeon. And if you're going to a neurosurgeon, and if that surgery is advised, take it very, very seriously, because no one gives advice of surgery without having a sense of responsibility, because doing a surgery can always have risk factors, it can always have adverse outcomes. So we would never like to give this opinion to anyone unless it is really required. But that's a surgeon's job. So if surgeon is seeing a surgical thing or surgical problem, he will give you a surgical solution. Many times people get fear with it and they want to go conservative, they want to try therapies which, don't even know that what is the structure involved. Like if you go to any other therapy, and they will say we can dissolve this tumor. It doesn't happen because, I mean, at least with medical science, the modern medical science, we know what we are dealing with. If there is a neuron, what kind of neuron is it? What is the location? Through MRI, we are able to see where exactly the tumor is. What is it compressing? With later on, if you've done a surgery, we can say this is a grade 1, grade 2, grade 3, grade 4 tumor. So with modern medical science, we have a very systematic approach. Do not try to chuck that opinion. You can take opinion of 3 surgeons, and then because we have to keep odd number, so say you went to 3 surgeons, and if 2 are saying do surgery, then just do it, okay? Because if you delay a tumor, it can spread to other structures. It can spread into spinal cord itself to a level that now by the time you get into the psyche of doing a surgery, now the risk factors are very much higher, and maybe with surgery you will complicate and you may deteriorate permanently. So if there is a tumor, it must be removed as soon as possible. There is no space of staying with it. It's going to only harm the patient.
Sorry, let's just to remind ourselves, the location of the tumor, does it also vary with the treatment, or does the treatment vary with the location of the tumor?
Yes, it definitely does. I'll show you, say this is a tumor which we call as intramedullary tumor, but it is inside the spinal cord. Okay, so if there is a tumor which is now very large, and it has stretched the spinal cord to a level that has become papery thin, operating such tumors is mandatory, but at the same time there is a very high risk that there will be now, because the neural tissue has been stretched to its limits. So when we are doing a surgery, we are handling the spinal cord. Even that mild handling can cause further deterioration. So sometimes it all depends upon the surgeon's competence. It also depends upon whether the hospital setup can actually deal with it. So if they are very close to the brain, right, at the junction of the skull and the first and second vertebra, it becomes very critical that these surgeries are done with great care. So they cannot be done everywhere. They can only be done at highly specialized centers. We have done them because these patients would later on may need a ventilator. So if they are in the first 4 vertebra, then it can be very high risk. Sometimes the tumor is smaller, then cyber knife or gamma knife can be tried, where we can arrest the increase in size of the tumor. So if it remains there, it may not complicate.
I think that brings us to our first break, but we're going to come back later. We'll have we'll talk a little bit more about spinal cancer, and if this also comes in line when we talk about spinal cord tumors. But we're just going to answer that when we come from our break. And I guess that brings us to the first part of the end of the first part of our show. We're going to go on a short break, but do not go anywhere.
Horizon TV, the beacon for the nation.
Discover a world of learning where the best of American and British education comes together in the heart of Kenya. Welcome to ILM Academy, where young minds flourish and dreams are realized.
ILM stands for Innovate, Lead, Mentor. In our school, we learn Arabic classes and we take also Madrasa classes.
At ILM Academy, we pride ourselves on offering a unique blend of the American and British curriculum, providing your child with a well-rounded education that nurtures creativity, critical thinking, and global awareness.
Our school uses a unique and innovative learning system. There are a lot of favorites I have in the school, but the one thing that stands out the most is playing football with my friends and bonding during meals.
Our experienced and passionate educators are committed to cultivating an environment that sparks curiosity and encourages students to explore the world around them. With the small class sizes, each child receives personalized attention, ensuring they reach their full potential.
We want to excel in education and our religious studies as well. We believe that every child is a holistic being.
But education isn't just about the classroom. At Ilm Academy, we believe in fostering a love for learning through a diverse range of extracurricular activities, from sports to arts, creating well-rounded individuals ready to face the challenges of the future. Enroll your child today and give them the gift of a world-class education. Our admissions are now open. Ilm Academy, where every child's journey begins.
Horizon TV, kurunzi ya taifa.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for staying with us here on Horizon TV. And this, before we went on our first break, we were discussing spinal cord tumors. And Dr. Mahendra, before we went on our break, you mentioned something very important. You talked about sometimes tumors in the spinal cord occur probably because of a cancer in a different area, probably prostate cancer, and it spreads to the spinal cord. Let's talk a little bit more on that, especially when it comes to what's the effects.
Yeah, I'd like to quote a case which I saw, and this will be case in point. We had a lady whose uterine cancer was operated in a big hospital. And then she was discharged, but after a few months she came with a progressive weakness in her legs. And because there was a progressive weakness and there's a clear-cut history of cancer being operated, so we did the MRI of the spine and we found that we call it secondaries. So the tumor has its primary site from where it generates, and then it will have a secondary site if it spreads through the direct spread or through the bloodstream. So it's called as metastasis. Okay. So she was cleared in the pelvis for the uterus and all these lymph nodes, but it was there in spine now. So her spinal cord was compressed, and so we did endoscopic surgery, and then she became all right the very day, same day. Okay. So it's very important if someone had a prostatic cancer in males or a uterine or a pelvic tumor in females, very, very important after the surgery to scan them for possible spread into spine. It's very important because anything which is in pelvis can actually get spread to the spine. Yeah.
Doctor, when we talk about it spreading, as you've mentioned earlier on, some of the treatment methods, and before we were on a break, we were discussing one of the treatment methods that you also administer when it comes to spinal cord tumors. Does this also apply to when the tumor from probably, or the cancerous cell spread it to the spinal cord from probably the pelvic area?
So metastatic tumors, lot of them, like in prostate, it spreads to multiple levels, and you can't operate all of them. So radiotherapy is a very important part of spinal cord tumors, or spinal tumors, particularly more for the spine tumors, which the skeleton, because what happens that the blood supply, particularly the returning blood, we call as a venous blood, that has got a component which always goes through the spine and spirals up. So when there are cancer cells in the blood vessels which are draining blood from there to the heart, it goes with a kind of complex, we call as plexus. There is a network of venous chain around the spinal cord. So it spirals the blood up, okay, So anything which is there, like even the infections or the cancer cells, if they are there in the pelvis, even before we know that there is a cancer in the uterus or in the cervix, it may actually go into the spine. So that's always a possibility. So if someone is operated or someone got operated for uterine cancer, should also go for the screening of the spine, because there can always be a spread above from the spine. So then the important thing is radiotherapy. If multiple levels are involved, for a neural decompression, definitely we need to do a surgical decompression. But I want to show you my computer, so we can show you what kind of radiotherapy is done. So this is nowadays the most modern radiotherapies are now available in Kenya. Like Kenyatta University Teaching Hospital has one CyberKnife as well. So we need a radiation for such patients, so that we can radiate a larger part of spine once we have done the decompression, for control of the metastasis. Although the prognosis remains poor, but at least we can prolong the life of the patient, we can reduce the pain, because with metastatic tumors of spine, there can be a very bad pain, severe pain in the spine. And then we can also do the pain management for such patients, where we can put some catheter on the spine and we can make them pain free.
Dr. when we're talking about, obviously, it's spreading from different parts of the body to the spine, is there any chance of it spreading? Probably, as you've mentioned, it goes probably with the blood vessels. Is there any chance of it spreading probably to other parts of the spine? Or can it
Spine
be different
definitely,
parts
yes,
of the spine at the same
as
time?
I said, that spine definitely it spreads. In many cases it spreads. Okay. Not only that, it can spread even up to brain through the same venous plexus. Then apart from that, if someone has got a brain tumor, and that can also spread in spine, we call it drop metastasis, because they can drop from the brain down. They're not literally dropping, but because of the lymphatic structure, it can actually spread there because of the common water that brain and spine shares. It can spread. So if even anyone had some certain kinds of brain tumors, or someone had pelvic tumors or abdominal tumors, they can have it in spine. So even from lungs it can come. So because all of these structures, spine is the center of all these. Even if you say chest, and then on the back of it, in the center, there is spine. So the spread to spine is very natural, and any form of cancer, if someone had, they should also look for, or their doctor should look for, the spinal metastasis.
Dr. when we talk about, obviously, the spinal cord tumors, when anyone who's listening, is it a question of genetics? Is it hereditary?
Genetics plays a part in predisposition. Like in breast cancer, there is a clear-cut genetic involvement.
Yes.
If mother had it, daughter has got far more chances, compounded by the risk factors which come, like maybe a late pregnancy or absence of breastfeeding and all. In spinal cord tumors, because they are extremely rare, we are not able to establish a clear-cut thing. But in general, if there is a cancer genes, it actually can increase the chances. But then we don't know if someone had if like one person had a spinal tumor, it usually does not implicate that the children will have it. So right now, we don't know that.
Once somebody has gone through treatment and probably it has been successful, are there any chances of it reoccurring or coming back?
Metastasis will usually always come back. It also depends upon how many levels are involved. So if the cancer is spread to 2 levels, 3 levels, 4 levels, definitely it's not going in the first place to complete obliteration. It will be there. Okay, it's just that we can reduce the symptom, because the bones in the vertebra are like very porous, and even infection in vertebra is very difficult to eradicate. So cancers are very difficult if they come, but yeah, it also requires a very wide removal of bony tissue. But if you remove, say, 3 segments of the vertebra, how are you going to reconstruct? You may require a bone from your leg, and then lot of screws and rods and so many things. It's basically a very complicated surgery. Fortunately, such incidences are extremely low, but yeah, we have seen and done those complicated cases, particularly in India.
Doctor, when we talk about spinal cord tumors and also seeking treatment, is there any way that whether you've got it or you're after treatment, is there any way that mobility is affected?
That's why I said that if someone gets a tumor and then if they've been told they do the surgery, because spinal cord at the best of its diameter is around 2.5 to 3 centimeters. Okay, so there is a very less space, and very soon deterioration can happen. So much before deterioration happens, if your doctor is saying that paralysis is a chance in spinal cord tumor, which is a very high chance, we must consent for surgery as soon as possible. Because if tumor size increases and encroaches more and more neural tissue has got a beauty. It tries to maintain the function till the very last moment. Sometimes to such a level that I have seen spinal cord getting transparent when I am doing surgery. It is so thin, still it is functioning. But I tell them very clearly that now if I am going to touch this spinal cord, they are at the last moments of function. Even handling that will further deteriorate. Okay, but that can happen. But mostly if you are doing it very delicately, the outcomes are very beautiful, they are very fantastic. So it all depends upon what stage you are consenting for surgery. Earlier you do, the better are the results.
Are there are there any things or treatments or basically anything that people can do to probably not get spinal cord tumors or prevent themselves from getting
No,
it?
there are very few chances, particularly if they had other cancers. Then the best thing is a good awareness, and then like in this case the hospital did the surgery, but further screening could not be done. So patient found to have someday a tumor. So of course the spread of the tumor cannot be predicted with great accuracy, but a high index of suspicion always helps. That if someone had a cancer, and cancer always spreads, even when the cancer tissue is less than 1 centimeter, it will spread through the lymphatics and through the blood vessels. Like in cases of breast cancer, even before someone is able to feel that there is something abnormal in the tissue, it spreads. Okay, and many times you have found that some cancers are found in secondaries rather than primary site. So if there is a cancer, someone is operated, they should go through a thorough scanning of the body. Particularly now we have got several PET scans there which can see whole of the body. So they should be screened in a way that we can detect very early if there was a tumor. Otherwise, for a general spinal cord tumor, how someone would know? Because you can get any kind of cancer, not in the spine.
Yes. Dr. When it comes to Nairobi Neurocare, what exactly do they do when it comes to, or what do they assist with when it comes to the spinal cord tumors and also its treatments?
Well, so far we have done few cases with a very different approach. We have been doing endoscopic spine surgeries with a daycare spine where our patients go same day home within 6 hours. So we applied the same principles for cancer patients. Of course, in cancer, patient will bleed more. Normal surgeries are bloodless. So because endoscopy is done in a water environment, so if there is blood and the camera size is about 2.5 millimeters, so we will not be able to see it. That's a general perception. But even we do brain hemorrhage removal through endoscopy, which I have been trained in Italy for that you can actually get into the blood clot and keep removing the blood clot till you find a white tissue, which is brain. So we apply the same principles here. We have done now few surgeries where we were able to, because someone has got a cancer in the uterus, now cancer is in the spine, tomorrow they will have cancer somewhere else, so their immunity is very much down. The cancer takes away a lot of your energy. So we want to conserve the energy by doing minimal tissue dissection, by doing minimal fixation of the spine. That can be done through endoscopy. So we always try endoscopy first, and we have been very successful in sending the patient the very next day. Because we did not do the muscle dissection, so they were able to sit and walk. So minimal energy dispensation of the patient, minimal hospital stay, and we were able to do these things. So at Nairobi Neurocare, with the help of endoscopy, which is our primary tool to operate anything, whether it's brain or spine, we have been able to cut short the hospital stays, and patients had a fantastic recovery rates.
When it comes to spinal cord tumors, is there anything else you'd love to advise the viewers when it comes to it?
The only thing is that first of all we need to focus on patients who had cancer elsewhere for a very high index of suspicion that you can have it. If you had a cancer at one particular organ and you had a successful therapy, just don't sit there. We have to find if this is coming somewhere else. So high index of suspicion in patient who already had cancer. For other patients, if they were having a pain in the spine and then it's going somewhere else, quickly go to a neurosurgeon. Try to find out if there can be, because if adult patients past 40 are high index, they have higher chances compared to the younger patients. So they should quickly go to a neurosurgeon and quickly get detected. And if there is a detection, usually the tumors are extramedullary, they are coming from outside the spinal cord. The results are exceedingly well.
Yes. Being reminded because of time, we've come to the end of the first part of our show. Is there anything else you'd love to add on before we close?
I think early detection is the key to spinal cord tumors, and we already covered that. So I just wish best of health to our viewers, and just keep a high index of suspicion. Any problem is there, then you must go to a doctor and get yourself checked.
Thank you so much, Dr. Mahendra. I think that brings us to the end of today's show. Thank you so much for staying with us. I think we'll meet again next week.
Yeah,
We
sure.
discuss the next ailment. So until then, goodbye.